what are the 3 top challenges that women face with thyroid symptoms? Because as most of you know that will watch this, you're going to learn or identify that, most people have had thyroid problems for months and even years. And there's certain reasons why the symptoms continue to manifest themselves even after you've been doing things that are, beneficial for, to get better, to feel more energy, to lose weight, to, to stop the hair loss, all those different symptoms that you know about. So we're going to go over 3 of the top reasons why women continue to be frustrated with thyroid symptoms and really what you can do about it. Because again, that's really what where my heart lies, is I want to help you get the information that you need and be an advocate for you so you can get better and enjoy life. Right? I mean, nobody comes or goes to a doctor, for that matter, just because they have thyroid symptoms. It's usually because they want to get better, to maybe it's play with their kids again, or be the best mom they can, or maybe they want to travel, or just have more of an enjoyment of life. For a lot of you that I speak with from all across the country, you've lost ambition for life. You lost enthusiasm or excitement. And you don't want to do the things that you used to do. And there's a reason for it. It's not that you're lazy. I've had stories of people telling their doctors, say that, oh, you're just fat. Come on. There's reasons for this. So the first one I want to go over, I got my little cheat sheet here in front of me so I don't forget you, because the last video I forgot to tell you something. So I make little cheat sheets now for myself. So the top 3 challenges that women face with thyroid symptoms. And again, if you have any questions, post them below. I only have about a half an hour today, so I don't know if I'll get to them all. Usually we fill up with a bunch of questions, but don't hesitate. I can only help you if you put your question in there. No questions stupid. This is a safe environment. You feel free to write down anything that you like, and I'll answer it as best as I can. The first challenge for women. A lot of you guys don't know if you have autoimmune thyroid. Why is this important? The number one reason for thyroid problems or symptoms in the United States anyways is something called autoimmune or Hashimoto's thyroid. You have to know whether or not you have this. Now, there's some classic signs. For instance, if your doctor, primary doctor, or your endocrinologist puts you on like Synthroid or levothyroxine, yet you still have symptoms, months, years later, that's a classic sign. Here's another one. Have you ever heard this? And if you ever heard this, give me a thumbs up sign. We did some blood work on you, yet your blood work is normal. Comes back, everything's fine. Have you guys ever heard that before? Because if you are, or you did, you're probably really frustrated because of that. And I can understand why. Because you know or realize that your symptoms do not correlate with how you're feeling. So think of Hashimoto's as it's an autoimmune condition. Think of this as a 2-prong approach where your thyroid's involved, but also your immune system. And if you don't address both, guess what happens? The symptoms will continue to persist. Now, there's no drug for this to address the immune system, and this is probably the largest reason why most doctors don't make a big deal of this. They don't treat Hashimoto's any different than they do from a plain Jane thyroid issue. And I don't say plain Jane just as a dismissal. It's just a thyroid problem, because it obviously affects a large amount of your body. But you have to know whether or not you have Hashimoto's. If you do, you literally think of it going down a path, right? Once you get to a kind of a T in the path, you can turn left or right. That's like Hashimoto's. You have an opportunity to go one side or the other. It's that different. And if you go down the wrong path, you're going to know. There's some warning signs, right? It's not like, okay, you made the bad decision, and all of a sudden, there's no turning back. No, that's not the case. But you need to realize that you made it, there's something going on, and address that. Otherwise, you keep being reminded that things aren't working out. And that's where women get frustrated. A lot of you that I speak with are doing some fantastic things. You're working out, you're active, maybe even eating differently, yet you continue to have the same symptoms. Sometimes it's even a matter of timing of when you do certain things. What I mean by that, think of a combination lock. You can have all 3 numbers correct, But if you don't put those numbers in the right order, you're not going to open that lock. Same thing for your health. If you're not addressing your body symptom-wise in certain timing or priority, it may be some good things that you're doing. So don't get hard, be so hard on yourself. It's not your fault, but you need to know what area needs to be addressed first.